of them so y'all can see the slight differences, because again, he's got very broad shoulders, so he's probably one that you would technically have to do one of each. But I want to show you all the differences in the light fields. Yeah, she doesn't have that issue.
Yeah, the core points up.
Yeah, she really does. So I'm going to show y'all how to palpate those. All right, so 40-inch SID. Okay. He's getting passed around today. Me and Mr. Girdle. That sounded so wrong. I'm so sorry. That sounded so wrong.
Here's a pass around.
Yep. All right. All right. Back against the board, sir. Now, yes, he has thicker shoulders. Okay. I am going to fix my collimation because I'm not doing sternum. Excuse me, I'm not doing T-spine. So I'm going to go 10. Okay. All right, so I'm going to do for demonstration purposes, I'm going to do your left shoulder because it's closer. All right, so when I'm setting this clavicle, doing this, just don't come up and start doing this to a patient. Oh, they'll be like, what are you doing? I'm just, no. It's like, all right, I'm going to get you into position, okay? Clavicle here, just below. He's actually got very nice coracoids too. And the other thing too that can throw people off when they have a muscular chest, you think you're feeling muscle, a lot of times you are. You're going just behind it, but it's literally, you come down and it kind of pushes back against you. Geese. So, come up. So when I was telling y'all before, I split the difference on the jugular. I get light field here. I'm gonna fix that in a second. Okay? Here, I only need to go an inch below. Coracoid is literally just below your clavicle. Okay? So I'm here, I'm actually where I need to be. So, because he's kind of he's actually bulked up since the beginning of the program. He actually used to be kind of scrawny. I'm just saying, you were a little more lanky when you started. Then you went and lost all kinds of weight and bulked up. So, jugular notch. If you have nails, don't, unless, they, But light field here, I feel medial clavicle. You want to, again, clavicle is part of the shoulder girdle, okay? Clavicle and scapula. It's important to include the entire clavicle on a shoulder, okay? So, all right, have him put his hand, his palm out like this. Now this here, people get worried. He's like, I don't have a whole lot of, I'm not worried if I can't see all of his humeral head, okay? I can pop my hand here, but I can still feel I got joint space in there, so I'm gonna see a little bit of it, okay? Grab my markers. All right, pop your marker right here, okay? Again, as I was saying here, the humeral condyles, parallel, okay, to my IR, or to my Bucky, okay? This one here, he's gonna be shielded, okay? Don't breathe, don't move. That's all we have to do for this one. Don't breathe, don't move. Breathing instructions are super simple, okay? All right, so, I feel you're gonna have great coracoids. Dang, you got two for 'em. That bony prominence right there. You're gonna have good ones too. Ooh, hers are better than yours.
Get it, girl.
Seriously. Dang, I don't have to dig at all because your clavicle's here, literally right. You can feel it on most patients. He's still somewhat muscular too, clavicle, and I might have to push a little harder. But yeah, his are right here. Same thing with Evan. Evan being broad shoulders, he'd probably be one like Steve. I'd have to do two. Don't try and switch it now. So same thing, clavicle. I have to push in a little bit harder, but he's right there. Okay?
Hi, how are you?
Right there. So,
Let's all push on Evan's
but
clavicle.
yes, everybody push on everybody's coracoids. So, but again, I just need to be an inch below it. Okay? Just an inch below. Okay, so arm here. Make sure, again, if you're using AEC in clinic, it would be center cell would be activated. Okay? Don't breathe, don't move. Only thing I have to do now, you can tell them to relax, it's fine, but I'm gonna have you stand right where you are, just relax. It's like, all right, I'm gonna get you to do now. I need you to take your hand and kind of turn it in for me. Now, this is the time, if we do this, this is fine. I don't recommend pushing it out too far, this for the humerus, but for this, because again, these are what? The humeral epicondyles are
Epicondyle.
okay, this is for our internal rotation. I shouldn't have to move anything. Tube, Bucky, lined up, change out my cassette.
For hand placement, is it here, here, here?
Honestly, as long as these are,
Okay.
the whole thing is just to get it, even if you have him, if I have him just do this, look, hold his arm out like that, it's fine. It's all your preference and what the patient can tolerate, because sometimes even doing this, you feel, I actually right now can feel that pull right here, and if they do have a, you can do that too. As long as these are perpendicular, that's the key. Now I know it tells you in the book this, and then turn the hand, but as long as you have the epicondyles perpendicular, you're fine, okay? You should not have to move anything. Changing out my cassette. If he slid one way or the other, make sure it's like, sorry, I need to come back. Again, I have light field splitting the middle of my jugular, so I've got clavicle here. I can feel that medial aspect there. Lets me know I'm okay. That's for your internal, external. Super easy. Same thing with gray sheet. I'm not gonna have to move a whole lot, okay? All right, have him relax, hand on the stomach, okay? Still shielded in the front, hasn't changed. He's gonna, that's what I was telling you about. Palm of your hand. Come back for just a second. No, just go extra for a second. So I can put my hand right here on the head of the shoulder, humeral head. These fingers hit the top of the shoulder. Right now, I'm actually hitting joint space. This actually wraps around into joint space. That's what they're talking about, the 2 inches. Putting your hand here, the 2 inches medial, 2 inches down. That's still same spot. Now go ahead and rotate. I'll keep my hand here. Okay, I'm gonna back you up just a little bit more. Right, crosshair is gonna hit right where my thumb is. It's right at my thumb tip. That's that 2 and 2. When I do, whether I do it on her, it's still the same. Okay. Again, I'm not worried that I'm not seeing, because I need it to come across the joint space. Okay. This is where your clavicle, granted it's unaffected, but it gets projected downward. Okay, because it's the way I'm obliquing the patient. So if I wanted to, you could actually, if you want to, you don't have to, collimate just a little. Not necessary. But again, I'm still hitting right where I need to. Right at that joint space. And you can actually feel, again, you can feel it, and I'm trying not to dig my nail into him. So, unlike you, you know, dig it right in the hip.
You've been doing it to me for weeks, you can do it too.
So, but right here, you can, now most of the gentlemen, and if they have a plain t-shirt on, a lot of times they'll shoot through that. They'll watch, again, emblems and stuff can still create, depending on how thick it is, it can still create some kind of shadow. So be mindful of that. If a girl has a sports bra on, leave it on, it's fine. The majority of the time, everything from the waist up, off. Necklaces, yes, tell them to remove jewelry, but honestly, it's so far over, it doesn't usually, does it? You might end up still hitting some of it on the medial aspect of the clavicle, so you gotta be careful with that. So, if they have a choker on, it's fine.
And if earrings dangle past.
Yes, if the earrings are dangling down, they definitely have to come off. So your safe bet, any Your dangly earrings, you can just mention, hey, dangly earrings, can I get you like these? I would take, and I mean, they're not down enough, but I would still take them off. So, all right. Yep, you're going the right way. So now we're going into the wide view, okay? All right, so.
We're switching shoulders apparently.
Exactly, this is what I was talking about. He did this on purpose. Because your patient, when you tell them to turn around, they're gonna do that and put that shoulder against the board. Like, that's not the one I wanted. I need the left shoulder. But for demonstration purposes, I am gonna show this one because it puts him closer. But best bet when you're doing it, hold on, I'll show him. I keep my hand on the shoulder. I will rotate them towards me in that instance and put that shoulder. I keep my hand on the affected shoulder. So I don't get, demonstration purposes, we're gonna show this one because it's a little bit easier to show. So, whether he's like this, so this right here, that's for, we're not doing lateral scapula yet. If they can put their hand across their stomach, do that. It'll still pull it up a little bit, but if we can get him to come up a little bit more, if he can reach up, show him what patients like to do. Yeah, he is, but they'll like lean down like this to get it super close. I don't need that, okay? So I'm gonna have him reach your arm all the way across, see if you can reach towards that shoulder for me. There we go. Pulling it into view. I'm gonna find his scapula border right there, okay? I get my hand right there. It'll fit the scapula. You go grab me a scapula. Oh, never mind, it's right behind you. Ha, yeah. Fits right in there. So I'm gonna have to slide him forward. Slide forward, slide forward, slide forward. Come on. There we go. I want that crosshair. Technically it's gonna come down a little bit. I'm gonna change my cassette to lengthwise. 12, 10. Did you have back day or something? Relax this arm for a second. There we go. There we go. All right, go ahead. All right, so I'm right where I need to be. This lets me know, actually, I'm gonna have to rotate you just a little bit more. I want this, my hand, to go straight into the board, okay? This lets me know where I need to be. The inferior border hits here. I still have light above here, okay? His inferior border is there as well, so I can still see light below it, okay? I'm gonna match my bucky, okay? People get thrown off because they think their humeral head has to be in the center here. No, the whole point, where's the scapula? Is this. I'm looking for this to be in the center, okay? Okay, that's what's gonna happen. That's gonna be in the center. Okay. Now, if he's rotated too much this way, obviously my hand's gonna be back this way, okay? So I rotate him up. Him, the 45 to 60 degree, sometimes it's as much as 70 to 75. Him having muscular shoulders, it's gonna throw it a little bit more, where you feel like you have to rotate more. There's gonna be some that you don't even have to rotate the full 40. And there's you're like, oh, you're okay. So, but him, I'm not too far from putting him into a lateral. But that's just because of the muscles in his back and shoulder, okay? All right, relax for a second. I'm gonna bring Miss Natalie over here. So she's a little more,
She needs her hair.
yeah, there you go, you're paying attention, I like it. All right, so when Natalie's over here, she brings hers up, I can still find her fairly easily, her inferior border right here. So if I bring her over, okay, obviously big height difference. Bring this down. Okay, I can actually feel her. Majority of your patients, you can run your finger along the spinal border. Okay, everybody come feel. Sorry, you're gonna be a petting zoo again. You can actually feel it, the border.
Okay, sorry. It's okay.
Get a little massage today. But you can still feel on her. It's not as easy on, now yours is sticking out right now, which is nice. That's to get right in there. It's beautiful. Love it.
Everybody touch Evan.
But it's one of those, it's not always easier to feel the more
gotta feel with
muscles
your
they
own
have
brain.
on their back.
Do that.
Yeah, this is where you have them put the arm behind their
Yeah,
back a
how's it
little bit.
Okay, right there.
Yeah, right here, that's the inferior angle. But her, majority of the time, your muscular patients, because I can still feel it on
Sorry, I got an
her.
itch there.
No, if you couldn't, this is where, as we did with Steve, bring the hand on the hip, it pushes it out a little bit. So that really pushes it out, right here. Okay, now keep your finger there, I feel the move, put it back in front of you. With her, you can still feel it, okay? Your smaller patients, you can. With Steve, him standing here like this, I can feel the border. When he brings it forward, it's harder because now it disappears into the muscle. I have to really, like, and you don't want to do that to your patient. So it's okay if you need to have him come back a little bit and have it poke out, and then you can find it, okay? All right, stay in the position, ma'am. All right, you're fine. All right, so with her, because she's got beautiful scapulas. So her, I'm gonna move her forward first. Both forward, I don't want you to.
My knees.
Yes, move your beats, move your beats. So this one here, you can come down. So this one hits right about the tip of your thumb, okay? So line everything up, okay? And again with her, on my border, the key here is I still want to still see that inferior border, even if I got just a little bit of light. I'm okay. Sorry, I'm digging my nails into your back again.
Okay, I just expect you to give this to Steve.
All right, so I want the crosshair to come across the border. Thank you. You're paying attention, I love it. So, again, this is not the correct one. This would actually be over here. So, but you want it to come along the spine. Oh, thank you. Perfect. This works beautifully. It's not, it would still be more rotated. But you want your crosshair to hit along here, so it'll be about right there, about mid-body, okay? All right, got you nice and straight. Again, I still have light field above. A lot of people get thrown off because they're like, oh my God, I'm gonna, no, you're not, I promise. Still have light above, okay? I still have light below. I still have, again, I have lots of light field here, okay? Correct marker.
Would you want her hair pulled up further because of that little section that's still? Okay.
Yeah.
Like it's still kind of in the way.
Yes, if you can get them to throw it out of the way, it would be great. So, but yeah, but again, want it to be on the border, okay? So that would be for the Y view there. All right, relax. Now her, so that was shoulder. So that's AP, your internal and external, literally just hand movement. CR should not have to move. Central right should not have to move. Same thing, gray sheet. All I'm doing is moving my patient into the CR projection field. Because even though we're still technically an inch below, that's still the 2 inches inferior and the 2 inches medial that we need. So I can do the same thing with her here. I'm still hitting, that's joint space, okay? Had to push a little bit harder on him because again, he a little, but I can still hit joint space here. Same thing with thumb. I can still feel it. Okay, so if I'm doing gray sheet with her, and do him, I would rotate because he's a little bit more broad, closer to 45. Her, I can get her to 35 and she'll be good. Again, we're looking for that joint space, okay? All right, so now we're gonna go to scapula. We'll do scapula with her first. All right, back against the board. Demonstration purposes, we're still gonna do left. You don't know if you're gonna have right or left on checkoff day, okay? All right, so I'm gonna have you step to the side. All right, ma'am, I'm gonna get you to take your left arm, bring it up and kind of either do this or put it on top of your head, whichever is easier for you. Okay? So this is where people get thrown off. They're like, but wait, we've gotta include. No. Scapula gets moved out at this point, so you're offsetting. Okay? So I'm gonna bring her back over. okay? I typically try to start here. I still have a little bit of light hitting my jugular, okay? The jugular notch. But now I've moved this out here. I can find my you still got great coracoid. Coracoid here. I'm still a little too low, so I'm gonna come up just a little. Right about there. I'm gonna reach behind. And you'll get to a point you eyeball it, you will not have to always reach behind your patient, but if it's one you're unsure of, especially your muscular patients, these are the main ones I do this for, I will reach, I literally will put my hand at the inferior border, it's like, ooh, I have a lot of light there. So I'm okay. And I'm actually at my 2 inches I need to be. I have enough light field here. Pop your marker right there. Make sure it's not in the shadow, okay? Because if I have her here, that's more shoulder. I'm not really gonna get a lot. I have to, remember, we pulled it out. So that's why we go slightly off center, okay? And it ends up, put your arm down. It's still looking like it's coming when you do this. So it looks like you have a normal shoulder projection where it's 1 inch further. And now as soon as I move her out, this is what throws people off, is the crosshairs. They're like, but it just doesn't feel right. When it doesn't, and this is gonna sound so wrong, when it doesn't feel right, it is right. In this instance. So, again, slide her just a smidge off, okay? Again, I still have light field on my jugular, so even if I'm worried, I'm still okay. This needs to be switched, orientation. For both your AP and your lateral. It needs to be switched out for your wide view shoulder as well. Okay? All right, so that would be for AP scapula. Again, AP scapula, you just have them breathe easy. Just tell them to breathe easy. Because we still want to blur long markings so we can really see. If you want to have them hold their breath, it's fine. But usually, just nice easy breaths. And you do it over a second exposure. And usually that 1 second exposure, since we're usually using 0.2 to 0.5 on most, it's enough to blur it so that we can really see the scapula pretty well, especially what little bits over the lung fields. All right, so this one here, okay. Have her do, I'm gonna keep my hand on her shoulder. Again, I would rotate her towards me if I'm doing a lateral scapula, okay? Have her move her hand behind her back for that one. But for demonstration purposes, because it's closer to the side, I'm gonna move to the right, okay? Sorry, ma'am. All right, arm behind your back for me if you can. This is great. This is the ideal patient, love it. This one's really nice because it really throws it out, and I can see inferior border here. This is the one that's really nice. I can get in here, scoop it up, come forward just a little, okay? This one here. This one, I'm literally, because I need to come down a little bit, where the first one, if I'm doing normal, it would hit the tip of my finger. This one is going basically nail bed. It's the bottom of my nail bed just above my hip, okay? Because I want to make sure I get it all. And I still have plenty of light here. People get confused. Right marker in there. Again, this is the one that you can just get in there and scoop it, and it hits right about nail bed, between nail bed and hip. Because this, again, scapula comes down a little bit further. And this is the one we're projecting it off of the humerus. Okay? So, all right, that would be for lateral scapula here. Steve, let's borrow him for a second. Assume the lateral scapula position, sir. Again, while he is a little more muscular, his throws out nowhere near as much as her though. Okay? But I can still, now him, his is because he's taller. That's where people forget height, body habitus. I'm gonna hit it right about here with him. Okay, because usually thumb, hip joint is technically hitting right about midpoint, because you want mid-body. I'll fix that in a minute. I'm gonna rotate him up a little bit more. A little bit more. He's the one that I'm not too far from lateral. See my hand still bend back? Let's bend you a little more. Okay, now I'm where I need to be. This is what I'm referring to when I use my hand wagging. That helps me. It's things I'm showing y'all are things my instructors use with me. But again, this one here with Steve, because he's longer torso, not that that makes any difference, no offense. You can. Everybody's scapula is not the same. He's got a bigger scapula than this one, I can promise you that. But again, I'm actually not too far from a wide view right now in that one. So my crosshair is going to hit right about there. So you want it hitting midpoint of the entire scapula, top to bottom. So. Please do not, yeah, you can relax. Again, I get too many people who are like, no, humeral head's got to be right in the center. I'm not worried about humeral head. The whole point is this. This is what I'm worried about being in the center, okay? That's the point of this one, or both of those. All right, so, all right, I'm gonna show y'all AC joints, and then I'm gonna send him to the back, and then we'll go into clavicle, because Mr. Gardner wants to use you too for that one. All right.